Doctors of Reddit, what's your thank God they came in for a second opinion moment? I can't count how many. I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else. I've seen. Of course, those are the patients that are the nicest and are profusely apologizing for wasting our time, and of course those are the patients that have a brain tumor show up on their CT scans. I'm an emergency medicine doc in the Midwest USA. The patient was transferred from rural nowhere to our tertiary care facility, big hospital with every specialist. Call was of really bad quality, but the transferring physician described a 21-year-old male that had rapid heart rate and breathing rate, low blood pressure, low oxygen, confusion, and a severe opacification on his chest X-ray on the right side. Diagnosed pneumonia. He gave him a ton of fluids, started antibiotics, put him on a ventilator, but he wasn't getting better and wanted to send him to us. Sure, send away. An hour later the gentleman arrives, and looks young, fit, and not the type to just drop dead from pneumonia. We roll him onto our stretcher and find a huge stab wound in his back. The X-ray finding was his entire right chest full of blood. We put a tube in it, gave him back some blood, and he had to go for surgery to fix the bleeding. Lesson: look at your patient. Dermatologist here. I have seen probably 5 instances of, my other doctor told me it was fine, that were melanomas. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. Oh God, where to start? I literally just admitted this lady to ICU. Had been coughing for ages, 60-pound weight loss, smoker for 50 years. Now she can't breathe and I got a CT, 6 centimeters mass, looks very suspicious for lung cancer. And the doctors for 4 years throughout this just gave her vitamin D even though she was losing massive weight and coughing up blood. Another guy who came in looked pale as a ghost. Chief complaint was fatigue. One lab test later found out his hemoglobin was 4, barely on the cusp of survival. Seems like he had iron deficiency anemia for years. Doctor gave him some iron, he got better, but no one looked into why he got it. Number 1, 2, 3 reason in an older guy is colon cancer. He died 4 months later from metastatic colon cancer. Another story. Last month was about to take a long trip across the Pacific. 1 hour in on the flight they asked for a doctor. I volunteer myself. I see this lady literally gasping for air, like waving her hands in the air because she can't breathe. Look through the meds, she's obviously an asthmatic. Listen to her lungs and faint wheezing, no air movement at all. I later grounded that plane because there was another 16 hours to go and she was on verge of being intubated. Later I get more story from family member. Apparently she wasn't been able to sleep well for past 2 weeks. Doctor just gave her sleeping meds, more and more of it. Told her flying no problem. I asked the family why can't she sleep? Is it because she wakes up in the middle of the night gasping for air, classic sign of uncontrolled asthma? They're like, yes, how did you know? Sleeping meds prob among worst things she could have gotten, and almost killed the patient by saying she could fly. People who get diagnosed with bronchitis when they have heart failure and literally drowning in fluid. There are doctors who give antibiotics and steroids for everything, especially when they have no idea what's going on. Maybe I'm biased because I work at an academic center, so I see all the cases who get referred in because they're too sick or no one can figure out, but at least a few times a week I'm like, wow, this person could have been saved or not end up this way if someone cared enough earlier on. I'm going to say this as a doctor. It's honestly scary every day how many patients I see are completely mismanaged. Some doctors in urgent care see like 45 patients in a day. How is that possible to be thorough? Like if only patients knew what the doctors missed or what not. Half the time I really think it's like going to a bad auto shop and not realizing they're just making half the crap up. Same thing happens in medicine, and except people's lives suffer because of it. I doctor here. I had a patient I saw several months before they came in for their visit, but well less than a year, which often means something could be wrong. In this case, as it turns out, nothing was wrong with her by way of complaints. She just wanted to get updated before getting some new glasses. We decided to just run the regular gamut of tests anyway, just because we might as well while she was there. She was a 50-year-old woman, fairly normal exam, Perfect vision, retina showed healthy, but something about her pupils really bothered me before I dilated. We chatted about it and I asked her if she banged her head or anything weird and she said no, but suddenly reveals this crazy history of an old meningioma, a type of tumorous brain growth, she had removed a few years ago. She had decided to omit this from her history with us as she didn't feel it was important, but we went and put it into the charts anyway. Turns out she got a CT done 2 weeks prior to her exam with me, which she says turns up completely normal. I tell her she should tell her doctor about this anyway just to cover our bases. Fast forward, patient shows up in my office ecstatic to tell me that my examination revealed that her tumor had returned with an incredible vengeance. She had no idea, was totally asymptomatic, and the CT she had prior to me showed what was very literally the size of a speck of dust, which the radiologist dismissed as artifact. On her return to her doctor, they decided to rerun the CT to cover their bases, and they found a quarter-sized tumor. Within 2 weeks the tumor went from the size of a dust particle to a quarter. She was rushed into emergency surgery as the tumor was growing super fast and was close to a blood vessel which could cause a massive stroke. She had it removed that day and returned to me after recovery to tell me of what got discovered as a result of my testing. She is now a long-time regular patient I have been seeing for about 10 years. I'm not a doctor, but I'm glad my parents took me in for a second opinion when I was complaining about a bad headache when I was 15 years old. I left school one day and went to the hospital for a bad headache. The doctor said it's just a virus and that I should just rest and take meds. I went home, laid down and took some Advil and carried on with my night. Around 1 a.m. I was screaming on the floor. My parents took me to a different hospital and they ran tests and eventually did a spinal tap and discovered a ton of white blood cells. Turns out I had bacterial meningitis. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head, and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had X-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he done goofed and that I would be talking to our mutual chief of clinical services about the incident. ER nurse here. Had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. 22-year-old guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I am an internal med doc. He had told his doctor he had a headache. I did a usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did exam and he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. One stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump and he said yes, but the other doctor told him it was normal. Edit, he lived by the way, but it was close a few times. So fellows, if you note a lump on your testicle, ask for an ultrasound and don't be embarrassed to bring it up. Second edit, for those of you who are concerned after examining yourself, there is a small soft area posteriorly that should be similar on both your testicles known as the epididymis. That is normal. A hard lump on only one side only is not. Monthly self-checks between ages 15 to 34 can be done, but since rare, 5 out of 100,000, not a general recommendation. My uncle isn't the smartest guy. He's also like 500 pounds and showers maybe twice a year, so he's a gross dude. One time he was bragging that at 40 years old, he had grown a third nut. Told everyone about how he defied science and now has 3 balls. Turned out to be an abscess and now he hates that story being told. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test. So I ordered a peripheral vision test. When I got the test back I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180, energetic and happy. Can I go ahead and speak on behalf of my doctor? 19 male at the time, 33 now. I felt sick for about a week, flu-like symptoms, didn't want to eat, just felt bad all over. One day at work I feel a very uncomfortable cramp/tear in my abdomen, so I go to one of those 24-hour clinics. At this point I'm slumped over, can't stand up straight without insane amount of pain, just generally uncomfortable and hating life. After a few hours at this clinic they say, "You probably have kidney stones, go home, drink fluids, sleep it off." This seemed fine to me. I was ready to go home and listen to the doc, all was good. But my girlfriend at the time, didn't last much longer than that, wasn't a fan of this diagnosis and drove me to the ER, against my wishes of course. After a few minutes at the ER they determined my appendix has ruptured and I'm going septic. Apparently, I was pretty lucky to not have died, though I did pick up bacterial pneumonia while in the hospital, so the recovery kinda sucked. Now I just have a crazy 6 to 7 inch scar on my belly to remind me to not avoid hospitals when I'm sick. I'm not a doctor but I originally went into the doctors because I was really tired. The doctor waved it off but my mom insisted I should get a CBC, complete blood count. They found that my platelets were extremely low, which resulted in them running additional tests to find that I actually had acute lymphoblastic leukemia. No idea to this day why my mom made me go back to get a CBC but I'm grateful. Psychiatrist here. A 30-year-old man with mild depressive symptoms was in and out of the hospital fairly quickly. He was under pressure from his home life, living with 4 roommates who were making life a bit difficult for him. No suicidal thoughts. He was cleared of all psychopathologies by me and 2 other doctors. A few months later he came back. Same symptoms, however this time he talked about 5 roommates. It felt wrong and I digged in his story. Tried to contact his roommates. He lived alone and was severely psychotic. I have no idea to this day how he hid it so well from everyone. Edit, a few more details. The patient talked, dressed and acted normally. However, after admitting him for a longer period we noticed he talked with his roommates often. He was single, no contact with his family and somehow working. However, in a routine job with little to no personal contact. After a few talks he also claimed other people's thoughts were sometimes thrown at him and sitting on his head, and he could thus read people's minds against his will. The interesting thing about this patient was that his internal world somehow fitted the external world. When asked, his roommates sounded perfectly plausible. They were not, for example, shadow people, Vikings, 12 meters tall, and they teased him by hiding his stuff. But he ate with them, watched TV with them and so on. Normally a person with paranoid schizophrenia, paranoid meaning all types of delusions, will have multiple symptoms, sometimes easy to see for the untrained eye. The patients can dress, talk and present themselves in odd ways, usually different from cultural norms. They can have incoherent speech, make up words and phrases or are clearly separated from reality. Another patient of mine insisted that I was in jail for medicating him, even when we talked. When we quickly scan a patient for psychotic symptoms we basically look for inconsistencies in the patient's experience of the world. The patients normally know something is wrong or weird or different, but often believe it is the world around them that have changed. This is due to discrepancy between what they experience, input, failed assessment of the inputs, due to the thinking disorder, and testing hypothesis based on failed assessments which collide with the real world. This will activate defense mechanisms like denial, wild explanations, accepting both realities at the same time and so on. E.g., I am not sick, my doctor must be a bad guy. Bad guys are in jail, my doctor is in jail, but my doctor is sitting right in front of me at the same time, he must have an identical twin or this is an alternate reality. This is usually the way delusions are made. This is my favorite story on this post I've read so far. I also have 4 roommates and thought about how they can sometimes be hard to live with for a moment. I now have to go home and make sure they're all real. Not a doc but happened to my wife and I. She was 3 months pregnant and did ultrasound. All normal. Baby heart rate was 99 and healthy. However, for some reason the ultrasound tech forgot to measure something and doc ordered a second ultrasound. Second appointment in about a month, as my wife wanted to delay as she hated having to drink so much and not pee so the ultrasound comes out clearer. I couldn't be with her for second ultrasound as work got in the way. However, she calls me tearfully, saying that the doctor ordered she abort the fetus for her safety and her health, and she insisted on calling me to let me know before she did the procedure. Apparently, The baby heart rate hadn't changed since first ultrasound a month ago, and this was bad enough to put mom at risk in pregnancy. I effing flew to the hospital. I can't remember how I got there, but I crossed heavy traffic to the hospital in about 10 minutes of what is normally a 20-minute trip. Parked on curb, jumped out and rushed to her room. Thankfully nothing happened to her yet. And I just camped there insisting on another ultrasound. I kept telling the doctor it was a copy-paste error. You see, the heart rate from first ultrasound to second was exactly the same. I just knew that the tech copy-pasted the first report and forgot to update that rate. I screamed bloody murder if anyone would touch my wife. Security was almost called until another doc came in and said just do another ultrasound to decide the issue. The ordered a second ultrasound and heart rate was normal. My son is now 10 and I remember that fear and rage every day I look at him. Not a doc but a nurse. At a clinic a lady came in for breast pain with a lump. I was in the room for the exam for safety of everyone. The doctor told her it was a sprained muscle and to go away. When he left the room I told her the name of one of our other doctors that specializes in women's health. Told her she could not let this go. She saw him and he referred her for some radiology and that's how they found her breast cancer. She later told us all this in a sweet card she sent telling us if I hadn't told her to advocate for herself she may not have followed up. Not a doctor but the patient. Went to my family doctor with the worst headache of my entire life. She dismissed it, telling me it was a tension headache and that I should take a Tylenol and lay down in a dark room. Over the course of the next month I saw her a total of 13 times, each time with worsening symptoms. First it was dizziness, then vomiting, then eventually I could no longer see out of my right eye. Every time she told me it was just a tension headache or a weird migraine, gave me a prescription for painkillers and sent me on my way. The final straw was when I was no longer able to walk properly. I would try to take a step, but all I could manage was this weird shuffle. She reluctantly agreed to send me to a neurologist. The next day I showed up at his office and was in there for less than a minute. He took one look in my eyes and immediately called an ambulance. Turns out I had hydrocephalus. My ventricles were 5 times the size they were supposed to be, and my brain was literally being squeezed out of my head. Go figure. This is my second story to post here, but a great story no less. Mid-30s man walks into my office with what looks like a black eye and a broken blood vessel in the front of his left eye. He went to his primary and it was simply assumed that he got punched or hit or something, and he was dismissed. He was noted to have high blood pressure, but a script for medicine was written and a follow-up in a few months. Gentleman comes in to see me to get another opinion on the matter, and I look at him and immediately start the line of questions. How long has it been there? Do you have a headache? And when you plug your ears with your fingers, do you hear a whooshing sound? He had a cavernous sinus fistula. I sent him directly to the emergency room with his family of 4 in tow and he was in the operating room within an hour of arriving. Saved his eye and possibly his life that day. The best news, he was a kitchen guy at my local diner which I frequent and they still treat me like royalty there when I come to eat. They all remember the time I saved one of theirs. Not a doctor and this isn't about a human. On New Year's Day, 2 years ago, our little hound dog would not get out of bed. Her back half was unresponsive, and she would yelp in pain if anyone touched her. We took her to the emergency vet, the only place open to get care, on January 1st. We were there for 6 hours. The place was a madhouse. Eventually, Doc checks out our pupper. They take a bunch of x-rays and the doctor tells us that there are no breaks, which means there are likely lesions on puppy's spinal cord, and our options are either very pricey surgery and a significant quality of life decrease, or put her down and save her the pain. They give us some pain meds for her and we take her home to think about the options. The next day we get into our regular vet's office. Dog is still limping and heavily favoring a leg. Regular doc inspects Poochie and asks what other doc said. After hearing ER doc's prognosis, regular doc advises us never to go back and informs us that our dog likely banged her knee really hard on the bricks of our porch and was just being a baby about it. 2 days later, Doggo is 100% fine. Former ER volunteer here. An elderly gentleman was brought in by his concerned adult children for chest pain. He wanted to believe his primary doctor that it was just some gas or heartburn, but his son just had a gut feeling and made him go to the ER with everyone so he could get checked out. Heart attack was imminent, like, We weren't sure if treatment would take effect in time to prevent it. Declared code blue, all hands on deck, place went from a quiet empty ER to sheer chaos in a few minutes. There is no doubt in my mind that gut feeling saved his life. This actually happened a few weeks ago. My sister went to urgent care because she had a bad cough and was having trouble breathing. They said it was a virus and gave her antibiotics. My mom took her to her primary doctor who confirmed it. 10 days later she wasn't better, so my mom took her back and insisted she get an X-ray. The doctor said, "I don't know why you brought her back and it's just a cough." Turns out entire right lung was collapsed, which showed on the X-ray. It had been for almost 2 weeks. The doctor called us and said, "You need to go to the ER right now." And then began an emergency surgery in the ER, admittance to the hospital for a week, and another surgery 2 days later. I have a story of a friend who was severely mismanaged. I've probably posted it before, but I'm too lazy to look. For 2 years my friend had been going to her GP complaining about migraines, bouts of severe vomiting, and dizzy spells. Every time, he would order blood work and then tell her she was fine. One morning she woke up, and after a sexy morning with her husband she could barely stand. She was so dizzy and had such a bad migraine. She told her husband not to worry, sent him to work and had her neighbor drive her to the emergency room. She doesn't remember arriving. When she got there she started acting erratic. They had to sedate her and sent her for a CT scan of her head. There, they noticed a huge mass in her brain. The hospital wasn't equipped to deal with that, so they sent her by ambulance to the nearest hospital that could, a 4-hour drive away. This hospital immediately sent her for an MRI. It wasn't a mass. They could actually see the mass growing as they did the MRI. No, she was having a massive stroke. She was immediately taken in for surgery. They put in a stent and had to remove most of the left side of her brain as it was all dead. Afterwards, she was in a coma for nearly 72 hours. They were uncertain if she would wake up, and if she did, if she would ever recover. Thankfully, she did. It took almost a year of physio and speech therapy, among a few others, but she has made almost a complete recovery. They even had their first child 8 months ago. Turns out she had incredibly high cholesterol. With all the blood work that was done, her GP should have caught it. When she confronted him, he told her that her diagnosis was wrong. That she hadn't had a stroke and had made it up. She went after his license.